Hi, I'm Dr. Lainey Rutko, a professor at the Johns Hopkins Bloomberg School of Public Health. Thank you for joining us today. Yesterday, Johns Hopkins launched its new COVID-19 U.S. map. This is a new comprehensive resource to view critical public health data in one place. Our goal is to make these data as publicly and widely available as possible to help inform reporting and ongoing conversations and decision-making about COVID-19 in the United States. The new map and the accompanying JHU county status reports that are embedded within it will help make the public, researchers, concerned citizens, policymakers, the media, and others better understand and track the COVID-19 pandemic. The map is educational and it is deeply democratic, meaning that it invites everyone at all levels of awareness and engagement to take part in a shared set of facts and resources to understand how their community, however large or small, is impacted by this novel coronavirus. The map and its JHU county status reports are not drawn from new proprietary data. Instead, they compile publicly available data to create a new, intuitive way of viewing a range of important inputs. At this point, the JHU County status reports update once per day, and the map, the US map, is updated throughout the day. Together, these resources represent a step change in the sophistication of existing visualization tools, and they will inform new insights about how to tackle this pandemic. Following remarks from our speakers today, we'll have time for questions. We'll take questions that have been submitted in advance, as well as questions from the chat box in Zoom, so please feel free to enter any questions that you have during the briefing there. Due to limited time, we won't be able to take all questions. We'll start by taking one question from each journalist on the call. Please note all participants will be muted during this briefing. And with that, I'd like to introduce Beth Blauer, Executive Director of the Johns Hopkins University Centers for Civic Impact.
Thank you so much, Lainey, and thanks everyone for joining us today. I'm going to go ahead and share my screen so you can see a view of our new US-based map. Just for purposes of background, I thought it would, just to give you a little bit of a sense and orientation, we started the idea of building a standalone US map when the world map that has been built and maintained by our colleagues in the School of Engineering, specifically Dr. Lauren Gardner, started releasing at a county level data that's rolled up in the global map. We saw this as an incredible opportunity to start to really zoom in and understand the impact that COVID-19 is having at a very local level. So the US map, as you can see it here in your frame, is really focused on giving you a sense of the impact that the disease is having, and it is rendering at that county level. So every county is now shown, and that's a bit of a departure from the way that the map renders in the global resource. While you're on this page, you'll see some familiar data. You can see now we have the rankings of the counties instead of the states or countries as you get in the map that's provided in the global view. So again, trying to give a more local perspective, you can look at the map and toggle between different views. So you've got the ability to look at the confirmed cases by population, the total death counts for each individual county, and the fatality rate, which is the death counts per population normalization. Once you've had the opportunity to experience this landing page, we invite users to zoom in closer to get a feel for their local community. So here in Baltimore City, you can see that you're able to zoom in, and when you click on Baltimore City, you'll get this detail that pops up that allows you to see at a glance the confirmed cases for your city, for the city, but this is typically reported at the county level, and the death rate, the death count, sorry, for that count for the city. There also is a thumbnail that will emerge that you can then click on the thumbnail and it will give you the local dashboard for your county. There's three main components of this dashboard that will allow you for you to be able to really explore this data. This is the JHU COVID county information, and it is organized in three components: health facts and infrastructure, population, policy, and cases. The health facts and infrastructure, we wanted to give users the ability to really understand how people are accessing healthcare in their communities, and what the critical health infrastructure looks like. If you want more information about the data and where it's populated, you can click on any of the icons and it'll give you a very good detail of what that data is and the source of that data. For the population domain, again, we wanted to signal that we're looking at some basic baselining for which are the sort of critical areas that we're thinking about doing further examination with this data. So we're looking right now at the breakdown of race and ethnicity across each county, but we're also looking at the percentage of poverty as a baseline, giving a sense of population, and then a further breakdown of the most vulnerable group to the COVID-19 virus, those people that are 65 plus. In this third area, we have the policy and case information. Again, this gives users the opportunity to see their very local data up against another critical area of data, which is their state data. So you've got the local data that allows you to see that information. And then you have this area here that is really helping you get a cumulative understanding of where the county rates against their own state information. And then we've included for each county the information around the particular stay-at-home policy that's been enacted in that county, as we track not only when those stay-at-home policies were adopted, but also the tenor of those stay-at-home policies. And then at the bottom of the screen, you'll see, again, the rolled up information around the cases with the fatality rate for that particular county. So at this point, I'd love to hand it off back to you, Lainey.
Thanks, Beth. Now we'll turn it over to Tamara Goye, a senior data scientist at the Johns Hopkins University Applied Physics Laboratory.
Good afternoon. The development of the new U.S. map was a collaborative effort led by the Johns Hopkins Center for Civic Impact, with participation from the Johns Hopkins Applied Physics Lab, the Johns Hopkins Bloomberg School of Public Health, and the Whiting School of Engineering. Technical support is provided by Esri and the JHU Sheridan Libraries. This is a broad and deep team, each playing a critical role in this effort. I'd like to note that at perhaps no other point in history has data and analysis of that data played a critical role in decision-making at a federal, state, and local level. Key data elements provided include the number of confirmed cases by county, number of deaths by county. Data provided in the infographics include health facts and infrastructure, which includes the percentage of population by age with no insurance, VA healthcare, Medicaid, Medicare, direct purchase, and employee insurance. It also includes population, which is a race distribution of populations. It includes policies and cases information, which provides a comparative statistics to the state, such as total confirmed deaths, fatality rate, and number tested. It also provides policy information, such as quarantine and date of quarantine. Other data provided includes number of staff beds, number of licensed beds, number of ICU beds, the poverty percentage, total population, and population age over 65. The data currently is sourced by the coronavirus COVID-19 global cases by the Center for Systems Science and Engineering at the Johns Hopkins University, the Red Cross, Definitive Healthcare, the Census American Community Survey. Johns Hopkins Applied Physics Lab is pleased to provide technical support during this challenging time. We hope that the new updates will aid experts in decision-making and identifying and implementing solutions to the challenges this pandemic has created for the world. Furthermore, we hope that the updates will also enhance the general public understanding of the virus so that they can make better informed decisions for themselves and their families. I would turn it over to Lainey.
Thanks very much, Tamara. Next up is Jennifer Nuzzo. Dr. Nuzzo is a senior scholar at the Johns Hopkins Center for Health Security, as well as an associate professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Dr. Nuzzo, you're muted.
Thank you. Thanks for that. And thanks, Lainey, for introducing me. And I'm really excited to talk about this very important new tool. We have been tracking this. I work with the Center for Health Security, and we've been tracking this situation since the end of December, when we first heard about reports in China. And one of the challenges has been from the beginning getting access to data to help us sense make what we are seeing, to understand the case numbers that are being reported, and to figure out where we may be headed based on these case numbers. Since this has started, not just in this country but elsewhere, policymakers, the media, members of the public have been reacting to daily reports of new and total COVID-19 case numbers. And this has only really given a very limited picture of what's potentially happening. Knowing reported cases is important for sure. Being able to see that there's a rapid rise in the number of cases that is reported can give us some sense of the trajectory that we may be on, and give us a kind of window into how quickly we may reach the upper limits of our health capacity. But the raw case numbers alone aren't enough to truly understand what's going on. If we want to understand the impact of COVID-19 in our communities and to be able to track its spread, we need to break these numbers down from a national or even a state level. We need to understand what proportion of a state's population is affected. County and city level data give us a much more nuanced understanding of the cases, hospitalizations, and deaths that are occurring, so that we can more appropriately identify areas where increased transmission is happening, try to understand what resources may be needed in order to mitigate the impacts of these infections, like, for instance, expanding healthcare resources. What we have been able to see through these visualizations is that not all communities are affected evenly, and not all communities are affected at the same time. And so when we think about making decisions about where to deploy our resources, understanding what parts of the country are most heavily hit and what parts of the country may have additional resource is quite important to be able to do that. So I'm really excited about the information that the new U.S. map provides. In addition, one of the things that is particularly, and I'm glad this is brought up here, the COVID-19 status report shown at the county level, and here we see Baltimore City. What this shows us is not just the case numbers, but also some of the potential risk factors. So when we think about what are the outcomes of these cases going to be, we need to understand things like, what are people's access to healthcare? What are their underlying health conditions? Do they have the kind of vulnerabilities that we know may make them more inclined to suffer severe disease or experience death? And so looking at the underlying demographics of a community, how many people are over the age of 65, knowing that those are particularly at higher risk for hospitalization and death. Understanding what the healthcare capacity in an area is. So for instance, if there are limited ICU beds, then we may need to think, as case numbers are rising in that community, how we either expand access in that community or potentially think about reallocating our resources elsewhere. So I think that this gives us a much more nuanced understanding of what's happening, and it supports decision making, which is really the whole purpose of collecting data in the first place. We want these data so that we can know better how to act. And one of the questions that's been really at the top of sort of national conversations is, when can we return to normal? When can communities go back to life outside of their homes? And we're hearing a lot of kind of high level stories about how we may be reaching a peak. And I think when you look at the map, in particular, you see the variation between counties. I think you'll see that having that conversation at the national level is really complicated because different communities are affected differently. And so when one community may be seeing a slow in the rise in cases, you may see that communities nearby are experiencing an increase. And so that really complicates decisions about how and whether to relax the measures that have been put into place. But ultimately, we need to be informed by these data, because if we make decisions to open too early, we could suffer very serious consequences about this. And so, no community is an island. Communities are going to be affected by the case numbers that are around them in their own state or in the region. So we should be mindful of these data when making these high-level decisions.
Thanks, Jennifer. Now we're going to move on to Q&A. Our first question is from Daniel Wood at NPR. Beth, this question is for you. How are data being collected and validated?
So we're using and leveraging a significant amount of the data that is coming out of the global map. So the global map and our map both have a GitHub repository where you can see all of the details around exactly where the data is coming from, how that data is updated, what the where the data sources are. So for the pandemic data, the data that's COVID specific, we are leveraging directly out of the global map. For the contextualizing data, we're using a mix of those data sources, and Tamara did a great job at running through what those data sources are. And we're constantly looking for additional sort of contextualizing measures. So in the coming weeks, you'll see additional data added, and you'll be able to see the source of that data in any of those flyouts or any of the documentation that's accompanying the map in the FAQs and also in the map itself as a reference.
Thanks, Beth. Jennifer, this question is for you from Andrew Witherspoon at Axios. For incident rate, mortality rate, testing rate, hospitalization rate, how do you advise presenting these numbers to the public? And what caveats would you include to explain the limitation of these metrics?
Yeah, so it's a great question. I mean, I actually think that these numbers make the case, presenting it as a rate, so standardized by the underlying population, I think makes the numbers make a little bit more sense when you can talk about 1 in X number of your community has been affected. I think that makes more sense than the total numbers themselves. It's hard for people to relate to the total numbers. So that's why I think it's important to have a denominator when we're talking about these numbers. I think when we're talking about the limitations, though, an important one remains, which is how we generated these numbers. And so we know in many communities, the cases that are reported are probably the sickest among us. And so when we do things like calculate how many of the reported cases have died, we get higher percentages than we would if we were able to test everybody who is sick, or maybe everybody in the community, even knowing that not everybody may develop symptoms. So I think that those communication challenges will remain. That said, I think there are efforts underway to try to better interpret these data, and that's why bringing more additional data categories to compare the case numbers to is essential. So for instance, Italy was in the news for quite a long time because of the high numbers of deaths being reported by Italy. But what was also interesting was that the age of their cases was much higher than in other places. And so if you just looked at the numbers of deaths, you would think that there's something, maybe the virus has mutated or there's something unusual going on about Italy. But if you don't also consider things like the age structure of the population or whether people are even able to access healthcare, you may not make sense of those numbers in the same way.
Thanks, Jennifer. Beth, I'm going to send this next question to you, but Tamara, I think you'll want to jump in as well. This is from Kyle Swenson at the Washington Post. Can you explain how the tracker is staffed? How many people are working each day to upload data? Is it mostly run through programs? Trying to get a sense of what it takes to keep something so wide-reaching running.
Lots of sleepless nights for sure. And I'm sure Tamara can agree with that. But we actually have a really kind of thin team, and also notably powered by women, which I think is something that we should also celebrate as we think about the work that we've been doing. But we've got some GIS expertise on campus that is in the Centers for Civic Impact. We built out the original U.S. version of the map, but we leveraged Dr. Gardner's work in significant ways. She and her team had been working already on the data collection. So for the COVID tracking data, there already was quite a significant routinized partnership between not only CSSE, the civil engineering group that Dr. Gardner leads, but also APL, where Tamara is, with the libraries, which have played an essential role in this. And then we have a team of analysts and analytics experts who are thinking about what should the data look like, how should it be gathered, how can we be most transparent in the sourcing of that data, and then understanding that we're taking a very global resource and trying to give a very local perspective. And so what are kind of the pain points around that? And so it is definitely been an exciting time. And Tamara, I don't know if you want to talk a little bit more about that process and how we've been staffing this, but from our perspective, we're also learning a lot through this process and figuring out on an ongoing basis what it looks like to continue to be able to provide these insights, which I think are really critical for those decision makers in the field who are having to make the tough calls every day and provide information to their local communities.
Yes, Beth, you summed it up really nicely. It is an interdisciplinary effort that requires support and contributions from scientists to data scientists to visualization experts to software engineers to developers. I mean, you name it, we're all up in here mixed together trying to help contribute to this effort. So Beth, you summed it up really nicely.
Thanks, Beth and Tamara. Our next question is for you, Jennifer, and this is from Dennis Wagner at USA Today. What about COVID-19 deaths that were not tested and/or deaths that were misreported as pneumonia, flu, or other illnesses? How does this affect the numbers we're seeing on the map or put them in question?
Yeah, so I'll let the team correct me if I'm wrong, but this will be a problem across the country. If we don't accurately attribute deaths to COVID-19, then we're not going to capture those deaths as part of the total burden that have occurred from the pandemic. This is not uncommon for respiratory viruses, and I would imagine that there will be retrospective studies. I know some hospitals, for instance, have collected specimens from patients and deceased patients, knowing that were they able to test them, they likely would have been counted among the case and deaths numbers, but because of severe limitations in testing, they have been unable to do that. So I expect that where we end in the end about deaths and even cases may look different than what we're able to track in real time. Hopefully though, with expanded access to testing, which is an incredibly important topic, we could close this gap a bit faster.
Thanks, Jennifer. I'm mindful of the time. We have time for one last question. Beth, this is for you. This is from Alex Tanzi at Bloomberg News. Data and data visualizations tracking the virus seem abundant and well developed. What areas are lacking and need to be improved?
So I think in one area that we're going to be also paying particular attention is the data that's being released at the local level and making sure that it's released equitably so that we can get a real sense of who has a disease. So one of the things that I think that we'll be tracking is which states are releasing their data with the race and ethnicity breakdown so we can get a real understanding of the populations that are being hardest hit. Another area where I think there's a huge opportunity are in what Dr. Nuzzo talked about as comorbidities. So understanding what are some of the other health challenges that particular communities are facing and being able to understand how they're really driving complications with dealing with the virus itself. And some of that data is available and some of that data isn't available. And particularly for those people that are sick, it's not necessarily clear whether or not those they may have comorbidity as something that's pushing the disease progression. But we can get that data at a population level, which may give us some appreciation for places that are going to be more vulnerable to more or higher death rates because of predisposition of the population in general. But we can't do that until we get the data specifically released about who in fact has the disease and how it is progressing in these communities.
Thanks very much, Beth. In closing, please visit the Johns Hopkins Coronavirus Resource Center at coronavirus.jhu.edu for information and insights about COVID-19, and that includes our US and global maps. And a big thank you to our panelists and to everyone who joined us today.